Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. We are going to be learning all about Thermo liposuction, a relatively new advancement in body contouring. Joining us is Dr. Eugene Nowak, a popular board-certified dermatologist who practices in Chula Vista, California, and the pioneer of this advanced liposuction procedure. Dr. Nowak received his medical training at Midwestern University and completed his residency at the POH Medical Center through Michigan State University, acting as chief resident. He has spoken internationally and performs as preceptor to many physicians, training them in dermatologic and cosmetic aesthetic procedures. Hey, I'm Amy, and we are joining you live from the studio today with Dr. Nowak, who is going to tell us all about Thermo Lipo, right?
Yeah, exciting stuff. Thank you for having me.
Absolutely. Thanks for being here. So we're going to just kind of warm you up a little bit, and we've got some questions for you, okay? So first one, why don't you tell us a little bit about your journey to plastic surgery?
Yeah. Well, it's really an amazing time. And so I trained when really aesthetics was just really starting and becoming, it was available to have lasers in your office. Before that, a laser was in a research setting or a hospital. And so I've really watched this industry bloom right before my eyes.
Right.
Yeah, so things that we only dreamed about years ago, now we have those options today. So we have things that are minimally invasive, minimal downtime, recovery time. And so really started, I'm a dermatologist by training. Grew up loving lasers and technology and trained in an amazing program where I was able to do a lot of aesthetic treatments during my residency program. And like I said, these procedures are just becoming available to where you can do them in your office. And that's where my focus is. Minimal downtime, minimal recovery time.
All right, well, we'll get more to that later, but I want to know, because it sounds like you work a lot, when you're not working, what are your hobbies?
So a patient asked me the other day, what do I do to relax? Well, cooking. I said, outside of cooking, I do go to work because I love what I do, but I love to cook.
What's your favorite dish to make?
Ooh, I can cook pretty much anything.
Really?
But the thing that I probably get the most reviews on or the most highlights is my brisket.
Brisket?
Yeah, my brisket, you could cut it with your lip.
Okay,
Yeah.
can we pencil that in
Can
for
we
next
pencil
time?
that in for next time? Absolutely. Yeah.
So tell
So
us
it's
a
a big hit when I take that to the office.
I can imagine. Everybody loves you.
Everybody loves it.
So tell us a little bit about one of your most interesting cases. Is there one that kind of stands out, a little different from the rest, or somewhere interesting that you worked?
Interesting cases. Well, there's so many. I mean, as I say, I love what I do and I never get tired of it.
Okay.
You know, I love to be able to, before I do a treatment for someone, I'll take a picture of them. And then halfway through, I'll take another picture of them. And then when we're done, we'll take a picture. And I'll kind of take them through the journey to say, okay, this is where we started. This is where we are partway through. And just in a matter of minutes, we can make a amazing transformation, but keeping them normal and natural.
Okay, so if you couldn't be a dermatologist, what would you be?
I'd be a dermatologist.
Why? Tell us why.
Well, so it's a part of medicine that you get to pick and choose what you want to do. And so I have colleagues that just do medical dermatology, and I do aesthetic dermatology. So I do lasers, and I do treatments to rejuvenate and make people look better and feel better. And there's actually studies that are coming out that if someone has an aesthetic treatment done, they'll feel better about themselves. If they have depression, their depression scores are less.
Wow.
They'll actually take pictures and show people and ask, before they had a treatment done, the person, they'll say, that one looked tired, or that one looks angry, and this one looks happy, and this person looks more approachable or more confident. And so every day I see those transformations of helping people.
So kind of to piggyback that, what would you say is the most rewarding part about your job?
The before and afters.
Yeah.
I mean, being able to show someone where they started and in a very short time period, we can make a transformation. Sometimes giving them back what they had before, sometimes giving them something that was just hiding underneath there, something that they didn't know was there.
Okay. What about travel? What is one of the most amazing places that you've been?
Did a cruise from Venice to Barcelona.
Wow.
Yeah.
Really?
And so Venice, I've heard people say not so nice things about it. I loved it.
Really?
It was very easy to navigate the city. It was beautiful. The food was great. Was there on an amazing day.
Okay.
There's only one day out of the year that they shut down the Grand Canal.
And
I
you
was,
were there?
I was there on that day.
Wow.
Yeah. So
How
I was
cool.
literally, they do a gondola race, and it's a yearly event.
Oh, fun.
And so I was literally in a gondola watching people racing gondolas down the Grand Canal.
All right,
And
check that
then
off the bucket list.
Check that one. I would love to go back and do it again, though.
So before I get into asking you some questions, can you tell us a little bit about your credentials and your background?
I'm a board-certified dermatologist.
Okay.
I went to medical school in Chicago, went back to Michigan,
Okay.
and did a couple years of internal medicine, 3 years of dermatology, practiced a couple years, and then opted to get rid of winters. And
I don't blame you.
Came to California. Yeah, so Michigan's a great place to be from, but the winters are so much nicer here. So, took over a practice from a doctor that was retiring and took it from a small retiring practice into a thriving, growing, wonderful practice.
All right. So we have you here today to talk about ThermoLipo, which is something that you pioneered, correct?
Yes.
So what is it and what can it treat?
Yeah, so ThermoLipo, we're trying to figure out how can we let people know we're doing something different. And
Okay.
so in my residency, I was trained to do lipo procedures.
Okay.
And that's a tumescent lipo, so it's done under local anesthesia. And
Okay.
so many people are surprised. They're like, I can be awake during this procedure. It's like, yeah, the patients are there. We're having a conversation. So not only do we do the shaping and contouring at that same time, but the question people always ask is, what's going to happen to my skin?
Right.
And the first thing is we don't give the skin enough credit, okay? Because women can get pregnant, have babies, grow many sizes, deliver a baby, and that skin shrinks down dramatically in a short
Right.
period of time. But we give it help. So as we finish the shaping and contouring, we bring in a different technology. It's thermage. It's a skin tightening treatment, radio frequency.
Okay.
And we do that treatment right there, right to that skin.
Wow.
So,
What areas of the body are we treating?
well, the midsection's the number one area
Okay.
that's requested, the number one area that people struggle with.
Okay.
And so, but we can treat arms, we can treat inner thighs, outer thighs, I can sculpt knees, we can work on the little back area, the bra fat.
Wow. Wow. Okay, so someone that's maybe interested in this procedure but not really sure where, is this, could this be an alternative to, say, like a tummy tuck?
It is for a lot of people.
Okay.
Yeah. So if someone comes in and they say, boy, I can't have the surgery, I can't have the downtime, I don't want the scar, then that's definitely gives them an opportunity. Yeah.
Okay.
And so some of the before and after pictures, you'll see them and you'll be like, where did the skin go? Okay.
Where does it go?
Well, like I said, the skin's elastic and it's going to pick up some on its own, but then that thermage that we do right afterwards is going to help tighten that skin.
Okay. Who would be an ideal candidate or a good candidate for ThermoLipo?
Well, first it starts with realistic expectations.
Okay, that's important.
Maybe we should talk about who isn't a candidate.
Let's talk about that.
And,
Who isn't a candidate?
Who isn't a candidate? So if someone has lost a tremendous amount of weight, there's
Okay.
no fat, and it's just all loose skin, okay? That's not really a good lipo candidate,
Okay.
So at that point, so if someone's had like a gastric bypass and they've lost 100, 150 pounds, they might not be a candidate there.
Okay.
They might do better with having that skin removed. But you have someone that has some stubborn areas, has the shape and contour that they don't want,
Okay.
and we can pinch in those areas, and the skin's in decent shape, they're a candidate.
Okay.
Yeah.
All right, good to know. How about cost? What's kind of an average cost for a procedure?
Well, the cost of the procedure is something that it's really individual.
Okay.
It depends on the number of areas that we treat.
Okay.
And, for your viewers out there, you want to make sure that you understand what is or isn't included.
Okay.
So, for an example with us, everything's included. So they go and have their lab and blood work done, but the lab sends me the bill. You don't get a bill. Okay.
So,
they get all
okay.
their medications. We measure them and we give them garments to go home with. They have a couple, say the clean one to change back and forth.
Awesome.
It includes a skin tightening treatment. We have them come in for follow-up visits, and they work with my staff, and we do some treatments to speed the healing process. And then 6 weeks, typically, when we take those before and after pictures, we'll even do a little extra skin tightening for them.
Okay. So kind of just, again, asking about the cost. If you were just doing, let's say, one area, what's kind of a general something to expect?
So it's rare to have someone do one area, but
Okay,
to give you,
what's common then?
to give you a range, it'd probably be 5 to 9,000.
Okay,
Yeah.
depending on how many
Depending on the
areas.
areas,
And the
depends if
severity.
we're adding. We try to do as much as we can, but we want to be safe.
Right,
You
of
know,
course.
I tell them, your safety is number one. Right there is getting you the best result possible.
Absolutely.
But safety is really number one.
Okay, so someone who is really interested in having this procedure, but maybe doesn't have the $5,000 to $9,000 saved up, what financing options are available for them?
Yeah. Well, that's something that we talk about right from the start.
Mm-hmm.
The world has really changed to where people before would not be interested in financing cosmetic or aesthetic procedures, and,
Right.
and that's really changed. And because people are used to financing everything, anywhere from paying for your phone to paying for your car, so paying for an aesthetic procedure to let them have what they want done now is great. So CareCredit is really our most popular option. It's got so much easier for the patients.
All right.
Because we can have it right on an iPad, and literally we can show them the options.
Oh, that's
we literally
perfect.
have breakdowns where for a lot of our procedures, instead of just the actual cost, is what would be the cost in payments for them.
Okay,
Yeah.
and you guys break all that down in the initial.
We let them know that it's available right
Okay.
there at the initial, and then it's really some patients are, yes, that's what I need, that's what I'm looking for, and some are not. But if they're looking for it, that discussion happens right from the start.
Perfect. So speaking of right from the start, a consultation, what can a patient expect on their first consultation?
Well, in our office, they can expect to meet with me.
Awesome.
Yeah,
We like
so
that.
yeah, I'm in the office all the time. We have consultants that will start with them. They'll take some pictures for us, so
Okay.
we can look at some areas, because we see ourselves one way, but when we look at ourselves so we use the Touch MD, we'll take some pictures where we can actually pull those pictures up. The patient can always access those pictures at home. Sometimes we'll do a little simulation, a little drawing to show them a little bit of what they might be able to expect in those areas.
Okay.
And that's where we put their before and after pictures also when we're done, so they can always look at those.
That's great. Are those pretty accurate usually?
Well, it's us doing the simulation, so it's really, we try to look and see the shape and contour that's hiding underneath there. So it's truly a sculpting procedure,
Okay.
and the result that someone gets really is by the physician that's performing the procedure.
Right.
That's an important thing. For what they should be looking in a consultation, they should be looking to see lots of before and after pictures that's
Right.
been done by that physician. There's been reports that it takes several hundred procedures to really get competent and really get confident to say, I know what I can do. I know I know
okay.
where I need to take it. I know where I don't need to take it. I know where I'm going to have a result for this patient.
During the consultation, are there any questions other than like, can I see the before and afters? Any other questions that the patient should ask during the consultation?
Well, like I said, everything that's included with it.
Mm-hmm.
Like I said, patients always ask about the safety of the procedures.
Of course.
We check an extensive amount of blood work to make sure that they're the young, healthy person that they appear to be.
Okay.
Yeah. If we need to get medical clearance, sometimes we do that if they have some medical issues or concerns.
Okay.
Yeah.
Are there any risks or complications associated with ThermoLipo?
Well, we call it a minimally invasive procedure because the patients are awake and alert. We check the extensive amount of blood work to make sure that they're healthy. We put them antibiotics and everything beforehand. Probably the biggest risk for me is that someone would have an allergic reaction to medication.
Okay.
Because people have allergies to bees. My daughter gets very sensitive. She can find it walking across the grass. She'll find a bee, and the bee will sting her.
Oh,
Yeah.
bless her heart.
Yeah. And so I was researching one day because you get a stronger reaction, and there's like 50 people a year that die from bee stings.
Really? I
Really?
had no idea.
And 50 people a year do not die from cosmetic aesthetic procedures.
Right.
But you want to be as safe as possible. You want to
course.
limit the amount of medication. I hear reports, people say, oh, they're going to treat my whole body. It's like, well, that's not here because that's not safe. So
Right.
safety's number one, getting them the best result possible, right up there at number two.
All right, I like it. What steps could a patient take to prepare themselves, their body, even mentally, before having the procedure done?
So in our office, we want someone that's on the pathway to say, I'm trying to get healthy. I want to make a change in my life, and I want to maintain it. Yeah, because our goal is to get them better, but also to make sure that they stay better.
Right.
So I don't necessarily tell them. I've had patients come in and say, well, someone told me to lose 20 pounds before I'd have the procedure. And if we lose 20 pounds, they probably didn't do it in a healthy way. I'll do the procedure, they'll walk out the door, and they'll gain 20 pounds.
Right.
Yeah. And so as long as they say, I'm ready to make some changes, I'm motivated, we bring anywhere from nutritional support if they need it. We have the M-Sculpt, which is something that can build their muscles tighter and stronger. So if people have some muscle laxity there, we now have treatments that can build that and help them. Yeah.
Okay. I have to know, how is the procedure performed? I haven't really heard about that, so tell us a little bit about it.
Yeah, so procedure's done for us right in the office.
Okay.
We have two ORs right there. The patient gets some medicine to relax them, but they're really there with us.
Okay.
And then we have to do some numbing. We take our time with the procedure. We take pictures. We mark the areas, so to kind of show the shape and contour that we're looking for. And then we have some numbing, and that takes an hour, hour and a half to numb the areas. The actual procedure is only 1 to 2 hours.
Wow.
Yeah, so the procedure itself goes quick, but then that thermage, that skin tightening part of it, takes us another hour, hour and 15 minutes.
Okay.
A couple minutes to get things wrapped up, ready to go, and someone has to drive them.
That was my next
That's a
question.
good
Can they
question.
drive themselves home? No, thank you. Do not.
I've heard reports of it, but for the safety of the patient and the
course.
safety of other people on the road, their safety is our number one concern. I have a lot of people say, "Oh, I feel like I could drive," but no, we don't let them drive.
Okay.
They have to have a ride home.
All right, good for you. What about follow-up appointments?
So yes, follow-up appointments for us are super important and part of the package. So
Okay.
if they have the procedure on a Thursday, Friday, Monday, Tuesday, they come in for their first visit.
Okay.
And that's where we just sit and have a conversation, make sure that everything is going according to plan.
Okay.
And if we didn't plan out their other visits, we're going to schedule it at that time.
Gotcha.
And they'll come in, they'll do some Z-wave treatments, which is a little radial sound wave treatment to help speed the healing process, break up any inflammation for the patients. They're wearing compression garments for 3 to 6 weeks out.
Okay.
So we'll see them for a couple visits. 6 weeks, we're going to take pictures.
All
yeah,
right.
picture day is a fun time.
I bet.
Yeah, because I can't tell you how many times patients will forget what they look like. Even some of the
believe it.
most amazing patient pictures we have is a patient, I walk in, she goes, I know there's a difference, but I was really expecting more. And I hand her a picture, and she's like,
Okay.
Are you sure that's me? She's like, because I don't remember looking like that.
Wow.
So, yeah, it happens all the time.
As far as results go, how quickly do you see results? And what about over time?
Yeah, great question.
Okay,
So
thank
with the new technology, you see it quickly.
Okay.
So years ago when we do these procedures, the incisions are small. Okay. They're really about as big as the end of a pen, just a couple millimeters.
Okay.
And years ago we would stitch them closed. Okay. And there was no leaking, no draining after these procedures, but it took a long time to heal.
Okay.
My sister had one of those procedures. She called me up at 3 weeks. She's like, when do I get smaller? She's like, I saw stuff that you took out. She's like, but I'm the same size. Within a week, she calls back. She's like, I lost 2 sizes in this week.
Wow.
So it happened, but it took time.
Gotcha.
Now, literally, I have patients that the next day will be texting us pictures. They'll be in the bathroom in the mirror.
The selfie.
And the selfie. Yep, the little mirror selfie. And they'll be sending us pictures, and you can already see a difference. So most people at that first visit, I can pull up their pictures, and they don't look like they started. So we're already seeing it. Okay.
Wow.
Now, there's still healing going on, and even at 6 weeks, we're probably 70% healed.
Okay.
So it's going to continue to get better. The skin tightening part. So if we did the whole midsection area, we would thermage that abdomen area,
Okay.
and that would get better for up to 6 months.
Wow. Is this a procedure that might need to be done again in the future?
Well,
Or is it a one and done?
the lipo part is pretty much a one and done.
Okay.
If we keep, as we tell patients, if we keep our weight stable, we're going to maintain the results.
Right.
Okay. If we lose weight, we're going to look even better. Okay.
Right.
If we gain a couple pounds, not a big deal.
Okay.
If someone gains 25 pounds, it's going somewhere.
Okay.
Yeah. Typically not back to where it was, but that has to go somewhere. Yeah.
Right.
So typically lipo-wise, at least with me, they're not going to need lipo in that area again. It's about 10% of the patients will say, wow, I wish my skin was tighter. If they have a lot of stretch marks, we might do some laser to tighten those up. We might do some micropen, some microneedling treatments. We might do some Exilus or even some more thermage if they wanted the whole area tighter.
Okay. You said the abdomen was the most common
The midsection.
area.
So
Okay.
for us, a midsection would be the lower abdomen, the upper. We'd work on the waist, the lower back, the upper buttock, really to try to shape and blend that whole area together.
Okay.
You mentioned earlier about tummy tucks. So
Right.
tummy tucks can make tummies flat.
Right.
Okay. But some people, it takes them out of balance.
Okay.
Because they look so flat here, this doesn't balance. And so I'll have patients come in all the time and say, okay, I need to now work on this area back here. So we'll help people that have had tummy tucks. But like I said, we can actually prevent it for a lot of people, and we can give them a better shape and contour than they would have with a tummy tuck.
Is this procedure, I'm sure it's very popular with women, but what about men?
Sure, men do these procedures also. They don't like to talk about it as much.
That's okay. Well, your secret's safe with us.
They might talk about having cool sculpting done or something, but the ThermaLipo procedure, they're pretty secretive about it.
Because it's cool, the cool.
It's cool to cool. Yeah.
Okay.
Yeah.
So, doctor, can you walk us through the procedure? Is it painful? What can the patient feel? And you said they're awake. What can they see?
Yeah, so great question. Most people, when we get to the end of the day, they say, wow, that was easier than what I thought.
Okay.
I had no idea it was going to be that easy.
Okay.
Sometimes you'll have literally patients say, I can't believe I'm falling asleep during this procedure. We give them just a little medicine to relax them. So it's in the Valium family. So that just, because most people are nervous. Even though we can talk about it, they can see videos of it, they can have a friend that's had it done, but when it's us, it's different. So usually they're a little nervous when they come in. I mean, to start the day, we take pictures. We then mark the areas, so we create a map or a plan of how we're going to do this. Because once they're numb and they're laying back, the shape and contour is different. So we've created a plan for what we're going to do. They clean and prep the areas, and then they're going to do some numbing. And so we make some little incisions about as big as the end of a pen. We try to hide them as much as we can along the waistline. But for a typical midsection, we'll need a couple here and a couple on the back. So we make as few as we possibly can, but as many as we need to get them the best result, okay? Because it's really about being able to reach all those areas. So the next step is we're doing the numbing, and it's called tumescent anesthesia. So it's a solution like you would get through an IV, but we add some numbing medicine to that. And we use a little instrument. It's called a cannula, and it's like a little straw with openings in the end, like a little mini sprinkler system. And so first step is we're going to numb the areas. And so if there's anything that they're going to feel during a procedure, that's what it's going to be. And so most patients on a scale of 1 to 10, it's a 3 or a 4.
Oh, wow.
Yeah, so you'll have some that are like a 0. They're like, nope, no problem, just keep on going. And occasionally you'll have someone say, no, we got to go a little slower. I'm a little sensitive there. Yeah, if they've had a prior surgery, prior procedures, C-section, something that there's scar tissue, then we have to work with that. So numb the whole area. Then it's a little puffy. Okay, so they're a little bit full right after that part. And then we let the numbing sit for a moment. And the procedure is actually an easy part. Most people in their mind, they think that's going to be the hard part. But it's not. Yeah, that's, for most people, it's the easy part. We use something called power-assisted equipment. So the little machine vibrates back and forth. It's kind of like the electric toothbrush of lipo.
Interesting.
So if you've seen the videos of the people really work, that's not what it is. At least not with me. So we use as much as possible. It just kind of moves. It moves 800 times a minute, so it's vibrating back and forth. And it's really like if you've used an electric toothbrush, you're just gliding through the area, removing tiny little instruments, just a couple millimeters in size is that cannula. So through that little incision, I can reach across the area. And we try to come in from multiple different directions, kind of in different layers to give the best result, the smoothest result. The instrument that I use has openings only on the bottom, so it doesn't take any fat off the surface area, so near the surface of the skin. So we try to leave a nice smooth layer there. And like I said, the patient's very comfortable. Now, some want to see what's going on. Some will
that would not be me.
Some will cover their eyes, but even the ones that say they don't want to see, they're peeking. They're peeking. They're peeking. And now it's more common to people like, can I take some pictures?
So what are they actually seeing?
Well, so the little instruments that I was talking about, the power assisted is moving the cannula. There's a little suction machine. And so that's collecting all the fat cells that are removed. So there'll be a little jar there, and that jar fills up. And then we take that one and get another jar, and we'll fill that one up. And most people were 2.5 jars.
That was going to be my next question.
2.5 jars. Now, they can already see and feel a difference. And when we're done, I'll literally let the patient, I'll take their hand and say, okay, what were we pinching earlier? And we were pinching this, and now we're pinching this. And there's still some fluid, there's still some swelling in those areas, but they can absolutely feel the difference right then. And some of them can see it. They'll be looking down saying, okay, it was up here, and now it's down.
So any of our listeners at home that are considering like, okay, I'm a good candidate for ThermoLipo, what's their next step? What do they do?
Yeah. So we have patients from all over the country that come and have this procedure done.
Okay.
Because there's a number of doctors that will do combining the skin tightening at the same time. And there's a couple devices for them to do it. Like I said, we use the Thermage device as our choice. Like I said, some patients will contact us by email, send us pictures, and we'll do a remote or a virtual consultation.
Okay.
And a lot of patients will come in. Some will just need a phone call and they're here. Some are here local and find us. They come in for a consultation. And that's, like I said, really where it is determining their expectations, the body or the shape that's hiding underneath there, because that's what I'm going to bring out.
Right.
So if they have some laxity of those muscles, like I said, some of those patients will have the muscle tightening, muscle building, the M-Sculpt treatment,
Okay.
that little diastasis, that separation of the muscles. Like I said, that used to be only surgery, but just with a non-invasive treatment, doing muscle contractions, it can tighten that about 11%. The muscle gets 16% stronger, breaks down a little bit of the fat cells. Okay, there's other treatments that we can do to help the muscles, the pelvic floor muscles with Kegels. So it's really finding their expectations, what their concerns are, and then creating a plan for them. And like I said, it's a very easy treatment. Most people, when they're done, say, wow, it was easier than what I thought. They don't have a big downtime. People with a tummy tuck, I've had people come in and say, I couldn't stand up for weeks. And like I said, literally, we have patients walking 20, 25 minutes the next day.
Wow, the next day.
The next day. So I have people that just walk around the house. I have people that walk around the yard. And I have people that go to the mall shopping because they're like, I need some new clothes. Yeah. I had a patient, she's like, I had to go get a belt. She's like, because my pants didn't fit anymore because she was already that much smaller.
All right, doctor. Well, thank you so much for your info on ThermoLipo. But now we are going to head to a lightning round, and I'm just going to ask you some questions, and then you just say this or that, whichever one you prefer. You ready?
All right, let's do it.
All right, cat or dog?
Dog.
Okay, hardtop or convertible?
Hard top.
Surf or ski?
Ski.
Golf or run? Eat. Good. We already talked about the foodie part.
Golf.
All right, golf. Night owl or early bird?
Night owl.
Decaf or calf?
Neither. I don't drink coffee.
Okay, what do you drink?
Yeah, vitamin water.
Good for you.
Yeah.
All right. Shop in store or online?
Online.
Online. It's easier that way. NBA or NFL?
NFL.
All right. Well, thank you so much for your time and all of your insight. We
Thank
definitely
you.
appreciate it. We learned a lot about thermoliposuction, an exciting and relatively new body contouring option from one of the country's leading board-certified dermatologists. If you're considering this procedure, we hope we've provided the information you need to decide if you want to take the next step and schedule a consultation. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Freina with CareCredit, and I will see you soon.